restrictions, more paperwork, higher costs in order to get less care. And that is going to affect people all across the state of Minnesota. We're looking at 60,000 Minnesotans losing healthcare coverage just because of the increased premium, the loss of those tax credits. That is a huge burden for those families, for those individuals, and also for the hospital systems all around our state.
It seems like a lot of the conversation today was about those premiums. That's been at the center of this government shutdown, I guess, situation as well. Before we get to that, do you guys want to talk a little bit about like the other aspects of federal impacts that we heard about today?
Yeah, do you want to?
I'll make one big. The trouble is they all multiply.
Yeah.
The SNAP cuts, the loss of the Medicaid, that's huge. That dwarfs this. But right now, at this point where the advanced premium tax credits are on the table, that's why we have to fight so hard to change that right now. But all these things multiply. All these things not just affect the people who get the care, it affects all the infrastructure behind it, all the hospitals. You shut down a hospital, it affects everybody. You make a hospital go underwater and have to shut down their maternity care, it affects everybody. And these sort of things, we're taking a system that's been struggling in the past, we're taking people who are struggling with cost of living, making it much worse. And that's not what the people want. I don't think anybody should be wanting that for our society.
The shutdown obviously is like the biggest federal issue right now. You mentioned that you guys are going to be covering that next week. What can we expect to hear about?
Yeah, we'll be talking hopefully with some federal workers who have lost their jobs, though that's folks are feeling challenged about speaking out about that. Looking at the day-to-day disruptions in people's lives, which we're now, hearing more about that SNAP benefits and WIC benefits will be cut off on November 1st, which is a huge change for most Minnesotans who use those services. We'll continue to hear more and more from the agencies as they receive federal guidance. I think part of the concern that we have is agencies don't know when they're gonna, turn to the federal government for a reimbursement or for a program that is typically funded and it just not be there because they're not receiving guidance on what will cut off and when it will cut off. So some of this is we're learning as we go in a really unfortunate way. 2 weeks notice to know that your SNAP benefits are going to disappear is not enough for people to make plans to figure out how to work around it. So we'll be looking into those actual impacts on Minnesotans.
There's some conversation today about the, I guess, sort of standoff happening at the federal level over those premiums and how they're going to increase and whatnot. What do you guys make of, as DFLers, the Democrats in the Senate specifically not wanting to pass something without guarantees that those premium benefits will continue?
First I'll say I can't blame them. Nothing that the Trump administration has done has said that this is a priority for them. Nothing that Congress has done has said that this is a priority for them. They could have included it in HR 1 if they wanted to, and they didn't. It was a choice that they made. Secondly, I will say we've been in a trifecta. We had a trifecta, and we understand that there are some bills, like a bonding bill here in Minnesota, that if you want to pass it, you have to negotiate with the minority party. They're not coming to the table to negotiate. President Trump has said to leaders in Congress not to negotiate, and so far it seems like they're following that line. If they won't negotiate, that is how government works. When you need the votes, you have to earn the votes. You have to talk with people, you have to compromise. And so far, not even being willing to have a conversation does not give me a lot of hope that this is going to end anytime soon. And I think we all appreciate our legislators, our senators, standing up for Minnesotans who told us today they cannot afford insurance if these premium tax credits are not saved.
What do any of you feel about what you heard from Republican colleagues today? Lines of questioning, maybe the comments made toward the end there. Thoughts on their stance?
don't have to be.
I think we heard the same thing we heard last week. A lot of changing the subject, a lot of deflecting. At no point in time did any of our Republican colleagues say, yeah, we should push our partners at the federal level to not cut these tax credits. No one said that. Instead, they started talking about the ACA in 2010. They started talking about fraud, which is the usual talking point. Removing health care from 200,000 Minnesotans is not the way you fix fraud. And so, unfortunately, I didn't hear a lot of hope coming from our colleagues here today.
Senator Port, you mentioned a little bit about, Minnesota being, I guess, maybe an example during a trifecta of working across the aisle, that sort of thing. We did hear from Senator Nelson, and I hope I'm not misrepresenting this, but she said something along the lines of, we should see the Democrats in Congress just pass a clean CR. I mean, how do you feel about that coming from her, given what you had just said about the trifecta a couple years ago?
Yeah, I mean, I think we have realized, Democrats in Congress have realized that these costs for Minnesotans are too high. The burden on families, on businesses, on hospitals, with all of these cuts, not just the enhanced premium tax credits, but also the cuts to Medicare and Medicaid that we heard from our hospital systems that will be devastating over the course of the next 10 years. Without making changes to those, just the cost is too high to the state of Minnesota, to states all across the country. I think that when you're in the minority, I've also been in the minority, you have very few tools. You have very few places where your vote matters. And this is one of them. It is one of the few places where a minority party can force a majority party to come to the table and negotiate. And that's what Democrats in Congress are doing. I think they're doing it for the people of this country who deserve to have health care, they can afford, for the hospitals in rural counties that will close because of these provisions. It is a hard decision always to hold the line, to put your foot down and say, we can't do this, we can't. But as we heard today, we can't do this. People cannot afford these costs. They will lose health care, and Senator Rest is right, they will die. People will die because of these provisions. And for me, standing up to ensure that people have access to health care, to ensure that there's a path for rural hospitals to not close, to ensure that people have just the simple dignity of being able to go to the doctor is a worthy fight.
My last question, in case I think of another one here. You guys we're still kind of in the infancy of this subcommittee here, but we've had a couple of meetings now. Realistically, at the state level, there are a lot of things happening in the federal government right now, a lot of these bills that you guys have been talking about, but what can be done at the state level by you guys, by your colleagues across the aisle, by the House, to respond to some of this?
We have big challenges ahead of us. We had big challenges ahead of us before H.R. 1 was passed, and now we have bigger challenges ahead of us. I hope that we come into this legislative session with creativity and a new sense of we cannot just put Band-Aids on these problems. We already had problems that were too big for Band-Aids, and now they've been blown wide open with Congress's actions. So, we need to come with an openness to find new ideas. That's part of the reason for this committee, is to really spell out the breadth of the problem. This is not something we can fix by just, going back to a high-risk pool. Are you kidding me? That's ridiculous. We need to have a different vision of how people can receive care in this instance. We need to have a different vision of how people are cared for in our emergency services, like SNAP, like rent stability, rent assistance. We need to think through, what are the ways that we as state government can reimagine what can happen? And I think some of that also might include partnering with fellow states who are looking to partner together now that we have a federal government that we cannot rely on as a stable partner. So I think all of those are on the table. We need to have conversations about them as legislature, but this cannot be a business as usual session or we will fail Minnesotans. We have unprecedented, I know that word has been overused a lot in the last few years, but this is unprecedented to have a federal government that is actively hostile to the state's programs that the federal government is supposed to support. And we have to come in with fresh new ideas about a better vision for Minnesotans.
I want to add one more thing about her committee. Senator Port and the Select Committee aren't going to find all the answers. It's partly for us gaining information for the public, for ourselves, so we know how to respond to this. But as Senator Port said, this is unprecedented. She said it was the first time federal government's actively going after states and state programs. It's the first time federal government's actively going after American people, actively going after people who are most vulnerable and taking away stuff. And we're trying to figure out how to do it. So I think the first thing we need to do is hear more, and that's what this committee's been doing and getting lots more information. Do any of us have ideas how we're going to deal with this, how we're going to minimize the pain? That's what we're trying to figure out, and I think the committee is extremely valuable in that.
Well, I know you guys have a bunch of other reporters here, so. Thanks, guys. Appreciate it.
Those who show up get to talk.